We have Professor Fousto Pinto. We want to welcome Professor Fousto. Welcome to Egypt.
Thank you.
Professor of Cardiology, Lisbon University of Portugal, and the President-elect European Society of Cardiology. Welcome, Professor. What's gonna be your presentation about?
Well, first of all, thank you very much for having me here. It's a pleasure. I've been here several times in Egypt, and it's always a pleasure to come back. Today I have a busy day. I'm giving 5 talks.
Oh, okay.
I just gave one on the new guidelines of the European Society of Cardiology on valvular heart disease. It was a very well-attended session and showing some of the new features of the guidelines on valve disease. Then I will speak in a couple of hours on what is called cornerstones of acute coronary syndrome management, where I will be also a little bit talking about the European guidelines on the management of acute coronary syndromes. Then I will give a talk more on the societies and the role of scientific societies in developing scientific knowledge and also improving medical practice. And then 2 more on imaging, which is my, let's say, my subspecialty. One on the assessment of valvular regurgitation, and the other one on the use of echo in acute coronary syndromes. So these will be the 5 talks I will be giving here today, and very happy to be here again.
Thank you. The activity of the European Society of Cardiology in collaboration with the cardiology. What is the collaboration in Egypt?
Yeah, well, the Egyptian Society of Cardiology is a member of the European Society of Cardiology, so it's part of the family. The European Society of Cardiology is a family of national societies. We have currently 55 national societies, and the Egyptian Society is one of them.
Wow.
The European Society of Cardiology is a big society, over 75,000 members. The 55 national societies, 6 associations, 18 working groups, 5 councils, and many colleagues and health professionals involved with cardiovascular disease that are part of the society. The main mission is to reduce the burden of cardiovascular disease in the ESC countries, and there are many ways where we can do that. Through education, and we organize many meetings, congresses. We have the largest congress in the world right now in cardiovascular medicine, which will be this year in Amsterdam. All the associations organize their own congresses. There are many educational courses that are organized throughout the year, either face-to-face, webinars, and so on. We're very proud of our guidelines, and the guidelines are very important to establish the best ways of manage patients with different clinical conditions. We are also very much involved in the elaboration of registries, which can provide us good information on how cardiology is practiced around the ESC countries. We also have a very good exchange with our national societies, and I think it's one of the societies, the Egyptian Society is one of the societies that we're really proud of the way they've been developing and they are organized. They've been very good, for instance, at disseminating the guidelines, the ESC guidelines, and organizing many sessions around the country to educate and to disseminate and also discuss many of the issues that the guidelines raise and that are very important for patient management, and the Egyptian Society has been very crucial for that. On the other hand, we provide fellowships, we provide training fellowships, research fellowships, where societies, so members like the Egyptian Society, can apply. We also provide some free registration for young cardiologists, which can less than 35 years old. The society can use some of these free registrations to bring some new people to the Congress. And there are many activities. We're also very much involved in what we call the advocacy towards, in this case, we just opened a new office in Brussels, so we can also be closer to the decision makers in Europe. It's a new office where we try to get involved in many of the processes of decision making in terms of. It's a huge society. Yeah.
Sounds very good.
Yeah. But for the youngsters, I think it's quite important to know that we have this program of Cardiologists of Tomorrow, which I know the Egyptian Society is also involved, which basically agglutinates all the young cardiologists at the earlier stage that we would like them to be involved with the society, so they can know more how the society works on one hand, and on the other hand, to contribute more to the society, so new blood to the society.
The young cardiologists,
yeah.
Focusing mainly on the young cardiologists.
Yeah,
right?
yeah. So, and that's one of our main concerns. So we are providing. There is this structure called Cardiologists of Tomorrow, which involves different groups from different countries around the ESC countries, where the young cardiologists can network with other colleagues from other countries. They can participate, develop activities, participate in some of the activities of the society, like the Congress. There is a special track for the young cardiologists at the Congress. They are also involved in the preparation of the program itself, and they're also developing some other initiatives, which I think they're quite important. So I will strongly recommend the young cardiologists in Egypt to get involved with the society, with the Egyptian Society, of course, and through the Egyptian Society with the European Society of Cardiology.
Finally, want to ask you about your advice to the juniors of cardiology. What's your advice?
Well, you have to work hard to be a good cardiologist. There's a lot of work. But I will strongly recommend that you get involved with your society and with the European Society of Cardiology, because there is a huge resource. There are a lot of people working to make good educational products. We have now a new digital platform which will make it easier, even at a distance, to get education. We have a whole set of journals, of textbooks, of many material that will be available online. So I would say that if you are a young cardiologist, there are structures like the Egyptian Society and the ESC who are helping you to develop your career and to be successful in the future as a cardiologist. And cardiovascular medicine is still the #1 disease in the world, and it will continue to be. So we need good cardiologists all over the world, and we need good cardiologists here in Egypt. And you have excellent cardiologists here in the country.
Thank you, Professor Fousto Pinto. We had the pleasure to have you here with us.